1 year ago, Oregon, like many states, was in the midst of developing a COVID-19 exposure notification app, but ultimately abandoned the project months later, citing low public interest and privacy concerns.
We didn't think we would get a significant extra level of protection and a tool that would significantly decrease the spread here across the state.
By contrast, by this time last year, Washington had already launched its app, and now it has 2.6 million users.
It's really a great app. Is already changing how we're doing exposures.
To look at the different approaches to contact tracing and case investigation on a state level, we spoke with Lisa DiFideli in Washington and Dr. Dean Seidlinger in Oregon. Washington's got more state workers dedicated to this process, 230, compared to Oregon's 87. But it's important to note in both states, there are also local public health authorities that handle most of the case investigations. State workers step in if and when they're needed to assist. Washington is still broadening its efforts.
Contact tracing is really important in trying to stop any inroads the virus may make into uninfected populations. We are still expanding our staffing, both with epidemiologists and with investigatory staff. And a lot of that has to do with surges that we've been seeing of recent and the up and down of cases.
Oregon, on the other hand, is narrowing its contact tracing methods.
With fairly high levels of disease, they aren't as effective because you could be exposed and not even know it. So our local public health partners have really focused during the recent surges and continue to focus on settings where there's a higher risk for spread. So think of places where people live together, skilled nursing facilities, other congregate living facilities that may have folks who are older or underlying conditions, our correctional facilities, shelters, and even schools.
There's also a difference in funding. The CDC awarded Oregon $34 million and Washington about $29 million. But the money doesn't have to just go to contact tracing. The funding also prioritizes more robust testing in high-risk, underserved communities. Those strategies vary in preventing the spread. Both DiFideli and Seidlinger say contact tracing will always have a place as long as the pandemic continues.
What it looks like for COVID is actually in some ways similar to what it looks like for other diseases. So it's tried and true method in public health.
And these are important tools that help us control a virus, but they're really helpful when the virus isn't kind of spread throughout our community.
Both agree. The vaccine and boosters are the most important protections against COVID-19.
So, Alma, will any contact tracing plans change now with news of the Omicron variant?
Well, experts tell me right now the response hasn't changed all that much. They're keeping a close eye on it, of course, and while it may be more easy to spread, Oregon leaders, for example, need to see if Omicron causes more severe disease, and that will determine whether they need to change course or amp up the response.
Very interesting. Thank you, Alma.